2 of in I'm s- I'm good. Okay. Good morning, everyone. Welcome to day 2 of Intro to Channel Theories for Treating Pain, part 2 with Marc. Today's webinar is recorded and presented by Lotus Institute of Integrative Medicine. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Before we get started, let me go ahead and go over some housekeeping today. The webinar will run from 9 a.m. to 6 p.m. There will be a lunch hour from about 1 to 2 p.m. and 2 short breaks in the morning and afternoon, and Marc will let you know when those are. The lecture notes for today's class, I am going to be working on them, and I'll let you know shortly when they are available. So we will be continuing with law channels today. And the chat room. If you are looking at, if you can find your chat room and you are using it, please set your chat room to all attendees and panelists. The correct order is all panelists and attendees. That way, everyone, when you're typing into the chat room, everyone can see what you are writing. It is automatically defaulted to all panelists. And when that happens, only Marc and I can see what you guys are writing. And the conversation there's some parts missing because other attendees want to know what you're talking about. So again, everyone do this right now. Set your chat to all panelists and attendees. The quiz will be ready tomorrow afternoon. The quiz for today's class will be available tomorrow afternoon. The quiz, if you attended yesterday, the quiz will be available today, and I'll let you know when you can go ahead and access that. The quiz, you have 1 month access period along with the video replay of the webinar. And for the video replay, again, I will send an email notification out, and that will be available tomorrow. All right, let's get started with today's webinar, and welcome Marc. Today we are back for part 2 with Marc Mastrandrea. The topic is pain today, and we have had this class with several other wonderful speakers, such as Dr. John Chen, Henry McCann, Brad Wisnat, Bob Doan, Colt Magbonwa, Chuan Min Wong, and Esther Su, where they each talked about their first and best go-to points for specific pain conditions we see daily in the clinic. So today, the style is channel theory, and Marc is going to show us what works best for him. Out of curiosity, how many attendees did not attend yesterday's webinar, which was part 1? If you missed part 1 of the class, you may be lost in today's class material because you're joining us halfway. So we recommend that you continue with part 1's class at a later time, for which a video course will be available next week. To keep the class organized and fair for everyone, if there are questions about what was covered in yesterday's part 1 class, please refer to the video recording from that class for the answer. There's still much to go over in today's class, so let's go ahead and welcome Marc.
All right, welcome to the part 2. So today we're gonna go over the low vessels. Yesterday we discussed kind of an introduction as to why acupuncture had changed, right? And why it changed in the Song Dynasty and what happened with that. And then we talked about how as things went on, we were reduced to only one channel, right? And we stopped using the 9 needles and we only used the filiform needle, which kind of today, that's the reason why we only have one style of needle, right? Some people, they have the lancets, but in general, most of them are based on the filiform needle. And then the techniques that we use today on the filiform needle are actually, much of them are based on what would have been used, like the chiseling technique, for example, what would have been used for the chisel needle, right? Or these different needles that were part of the 9 needles. So we briefly touched upon that. You can find more information about that in various books and things that are out there. But if you would like to go back to essentially what is really like classical acupuncture, it would have been things that were pre-Song Dynasty, right? Kind of, if you kind of think about it like that, because all the channels were taught before that, and then they were truncated after that. And so I think it's really important, again, in this class to show this, because to show a lot of other channels that could be used to treat pain, but also understand the physiology, right? This is just touching briefly on it. And again, I really encourage any of you guys who are interested in this to go and study the works of people who teach, channel theory. Particularly, I studied, a lot for many years with Jeffrey Yuan, and I highly suggest him. So, all right, let's get started. Sound is delayed. That might be an internet thing. All right. let's get going. All right. So today we're going to start on the luo mai, right? The luo mai are these ideas of these interconnecting webs, right? This luo means something that's a web, right? So the luo mai we call today the network collateral vessels, right? Anything that's not the primary channel, anything that's not the jing luo, right? We call a collateral channel. So something that's a secondary channel, right? So that could be a Jinjing, a Sinew channel. It could be a Jingpia, a divergent channel, right? It could be a luo mai, right? So these are things that assist the primary channel in day-to-day life. The 8 extras would not really be considered a collateral in that sense, I think, because they have a primary reason for creating life. So in my own personal clinical experience, I would not really consider them a collateral in that sense. They're lumped in as secondary channels, but they really have a primary reason for being in and amongst themselves. So a luo in Chinese language, luo means something that's a web, right? A network. The term for internet, for example, is wang luo in Chinese, right? So luo means something that's connected together, right? So something that winds around something, that encompasses and envelops something that contains something in this net or web-like structure, something that's continuously connected and threaded throughout. So you kind of get an idea what the word luo means, right? So things that this is used to describe in Chinese are veins, both in the human body and in the earth, right? Veins in the earth, the di luo or di mai, like the earth vessel, right? An earth pulse. So you could think of things such as veins of water, or really even more than that, the idea of these longitudinal lines of the earth, that ley lines, right? The idea that there's energy of the earth that moves in different directions associated with things like feng shui, right? So that's something that could be associated there. Collaterals, right, is another word that luo can mean, right? Channels that are collaterals to the primaries, right? The term mai, right, means a vessel, a vein, or an artery. Generally, it's attributed to something that has a pulse. A mai is something that generally pulses, right? That has some sort of movement and pulse through it. Whereas luo itself just means a threaded connection of things. Mai would mean something that has a movement or a pulsation. So an idea of a blood vessel, or the pulse that you take, right? Or something that is the pathway of shui, blood, or qi, right? So this is the idea of mai, right? Oftentimes blood and qi move through mai. So the luo mai. The luo mai are these connecting channels, right? They emerge from the body as the body needs them due to abnormal conditions. So when I say emerge, I mean they come to the surface. You can see them, right? They fill with some sort of pathology. So they occur under abnormal conditions in life, in the body, which lead to qi and blood not flowing correctly. All right. This idea of what we call ni qi, or the idea of counterflow qi, right? It's not flowing correctly. Luo mai are created as needed to hold something away from the jing luo, the primaries. So these idea of filling and being created to push to the surface is the action, the pathophysiological action of trying to hold the pathology or the issue, the counterflow, away from the primaries so that your primary channels can be unobstructed as much as possible, right? So the luo mai, while the luo mai exists physiologically within Chinese medicine, as I mentioned yesterday, we observe them being created and only treat them when they are created to store pathological issues away from the jing luo, right? So these collateral channels are created and emerge as a reaction due to abnormal conditions such as qi and shui, right? So this idea of blood and qi not flowing correctly, right? Like I said, it's associated with what we call ni qi, or rebellious or counterflow qi, or the idea of what we call CEUs, which is blood stasis, right? Through the use of blood, right, or jinya, the body looks to hold the pathology off in containment away from the jing luo. So it's like a closet. It's like something you can push things off into to try to keep the jing luo clean, right? You can try to keep it out as much as possible, and you store in these closets. But in order to do that, you have to use two things, right? You have to use blood and qi. So you're using your resources, blood, to kind of gain you the ability to buy more time. And that's the idea of qi, right? That's this idea. Stuffing things, stuffing an issue in the closet. I'll deal with it later when I have more ability to do it or I have more time to deal with it. I'll deal with it then, not now, right? So it's a distraction from the present moment that you're trying to put into the law vessels. This is an idea of how the law developed pathology through various things. So, for example, in sports medicine, we can think of it as an injury that you don't want to let fully heal, right? And you got to get up, you got to go back to work. You can't let it sit there. And so you get up and you push yourself back to work, and that swelling doesn't really go down. And eventually that area forms varicosities, right? Because you never took the time to really actually fix it. Instead, you push yourself to try to go, and it pushed the pathology out of the main channels and maybe pushed deeper than the Jing, than the sinews, and the Lomai took that and held it off, right, for a period of time. So this could be an idea with that. There are other ways the Lomai are associated. I strongly suggest looking if you can find the NISA transcripts by Jeffrey Yuan on the Lomai. They're very, very in depth on the Lomai and what they do. A lot of these things that he teaches are not what you see in common Chinese medical texts, because a lot of this, as he taught us in Swedish Institute, were developed in Taoist traditions. So there were more things that you would find in things like the Daozang, the Taoist compendium of hundreds and hundreds and hundreds of scrolls of Taoist texts, religious and spiritual and medical and otherwise, or things that were passed down through Taoist temples and whatnot. Traditionally, Luomai were also used to treat psychological issues, traumas, and things like that. That's probably where many of you have heard them used, or social and cognitive development of people, as far as being able to deal with society and, release, suppress trauma or stress. This is a very common use of the Lomai that people use it for. This aspect was developed more within temples or sanctuaries than it was by the common doctor. Now, traditionally in China, you didn't go to your doctor for psychological issues. You went to your priest, right? Or your monk. So whether it be Buddhist or Taoist, the same thing in the West, really, all the way up until maybe Freud and earlier than that. And even now, we still do this a bit. You go and you relate a lot of your emotional, psychological issues to a person in the community, if you're religious, who would be associated with a church or some sort of religious organization, right? And so a lot of these techniques of psychology were developed within these organizations over time, or within these religious sects and groups, in the goal of helping people, right? And so in China, the idea of treating these emotional issues that oftentimes the Lomai are used for were developed in Taoist temples. So that's why you don't find them taught a lot in Chinese medical lineage as far as just general doctors, is because you didn't normally go to a general doctor to deal with a psychological illness. If you really had major issues, you were sent to a temple where you would stay with the priests, and they would, treat you and deal with you and help you through meditation and acupuncture and whatever else there. So that was a major thing. And even to this day, when you go and you stay at certain temples, you can notice there are still actions of stuff like that. Like, for example, not to get too off topic, but the idea of allium plants, the idea of things like onions, garlic, scallions stimulate Wei Qi, right? We talked about Wei Qi yesterday. Well, Wei Qi can also be somebody's mood, right? The expression, the sudden expression, oftentimes without necessarily reason or logic of, an emotion, right? That can go out. So if you're treating somebody who has, very strong emotions, psychologically impacted by trauma or whatnot, you want to help calm the Wei Qi, right? Calm the mood. And so a lot of times you will notice that a lot of the diets in these temples, for example, would be devoid of allium plants. They would not have many in the diet of those who are meditating. Why? Because it helps to reduce the mood of the person, which they're not really in control of, and helps them to logically look through their emotions, right? And apply logic and reason to their emotions. And so when I spent time, for example, in Korea, at some Buddhist monasteries there, the diet of, kimchi is very popular in Korea, and we'd have that. It was a vegetarian diet at the Korean Buddhist monastery. And It did not have any allium plants in it. And kimchi oftentimes has scallions and various things that are, allium plant based in it, but it had none of that. None of their cooking had any onions, garlic, scallions, leeks, none of that. And so this aspect of learning to treat emotions through the use of psychological, emotions and psychological problems through like Taoist and Buddhist temples is still kind of alive in Asia today. You can still see it. And you can see it in various things in diet and whatnot if you're looking for it. So the luo mai were used a lot to treat psychological and emotional issues somebody might be going through in that sense. So he is a Taoist priest. He teaches from that perspective. So I would suggest if you're more interested in that for the luo mai, you definitely pick up his classes again on Vimeo or through NISA. Excellent classes. Let's see. All right. Let's see what else we have here. All right. So chapter 10, right? Because the goal of this class is musculoskeletal pain and musculoskeletal external injury. So I'm not going into any of the emotional stuff and whatever. We're trying to stick with this. So, but I will talk about some of the pathophysiology that can relate to B syndrome and stuff like that. So we will talk a bit about that. So the Ling Shu chapter 10, right? So this gives you the sequence of the luo mai, right? Which is different than the sequence of the Jing luo. So this is the reason why many people will argue that the luo mai aren't just a kind of a collateral, but it's really the primary, just creating the luo mai, and it's really the primary. No, it actually has a separate sequence. So this is why people argue that or suggest that the luo mai are actually channels in amongst themselves. They're separate channels from the primaries. So that's why the primary channel doesn't treat the luo mai. You have to treat the luo mai directly, right? So these are collaterals that are not the Jing luo. They have their own order. They have their own principles and treatment, right? So here is the order according to chapter 10. So first thing we start with the hand yin channels, right? And then we go to the hand yang channels. There should be hand yang there. Then we go to the foot yang channels. And then we go to the foot yin channels, right? So, and then from there, we're going to go to the hand yin channels. And then, so that's the whole circulation here. So this is, I don't know what happened in the restructuring of this to a PowerPoint, but it kind of messed up the way it was ordered when I wrote it out. But you'll see the hand yin. So it would go hand yin, hand yang, foot yin, hand yin, right? So hand yin, hand yang, foot yin. So the hand yin channels, it starts with R, the tai yin channel. Then the tai yin channel of the hand, right? So that's the lung. And then the xiao yin channel of the hand is the heart. And then the jue yin channel of the hand is the pericardium. So it starts with lung, right? And then from there, the second one is the heart, which starts at tong li, right? So the heart, so the lung channel starts at lia qie, lung 7, right? And it moves out through, and we'll talk about this more, but it moves out through the palm and spreads out to pericardium 8, right? Lao gong. And then from there, you've got the heart. It starts at tong li, and it moves up the body, and it moves to the heart, and then it moves up to the head, right? So it's moving things out of the chest. And then you've got pericardium, right? So pericardium starts at neiguan. Everybody knows PC6, right? So heart 5 is tong li, PC6 is neiguan, and it moves up and into the chest, right? And affects the pericardium, moves into the pericardium and the heart there. The pericardium and the heart are the only two luo vessels that move to their associated organs. None of the other luo vessels do. So the hand yang channels they start with small intestine, that's hand taiyang, right? Then it goes to large intestine. Then it goes to the sanjiao, right? The xiaoyang luo vessel of the arm. Then we go to the foot yang channels. So we go to bladder, and then we go to gallbladder, and then we go to stomach, right? And then the foot yin channels are the foot tai yin is spleen, right? Then we have the foot xiao yin is kidney, and then the foot jue yin is liver. So you are saying that those who have emotional problems should not eat onions. It's a little more than that. The idea of those who have hyperactive wei qi should avoid the idea. So they have an expression of mood, that they're not really controlling very well, and you're trying to help them calm down and work on their emotional issues. through logic and reason and trying to help reduce the possibility of mood, and having these kind of emotional outbursts. The idea is one of the aspects of treatment would be dietary, right? Avoiding stimulants, avoiding allium plants. Allium plants stimulate weight qi. So that's what my reference was to that. So let's see here. So we end with the liver. So it starts with the hand lower vessel. And the hand lower vessel is trying to move heat out of the chest, right? So we know the lungs are here. It's going to try to shunt heat off of the primary channel out of the chest, try to clear heat out of the chest, right? And we end with the liver. The liver is the idea here that after trying to move this heat, after trying to move this pathology out of the primary channels, it ultimately comes back in and ends up depositing, because you're not able to get rid of it, back into the essence, back into the Jing, back into the genitals, right? That's the idea and of this. So it gets pushed into the constitution at that rate. It actually starts getting pushed into the constitution at the gallbladder law, but it kind of finishes pushing into the constitution if you're not able to clear the pathology at the liver law. That, again, isn't something that we're going to be really talking about in depth because of the fact that we're dealing mostly with how to treat direct musculoskeletal injury and pain. So we're going to be focusing on that. But if you're more interested in those aspects, I strongly suggest, again, Jeffrey Yuan teaches this on Vimeo or the NISA transcripts that you can find online on PDF. All right, so I've drawn these out for you. So you have these. There's a lot of people who draw these out, but I drew these out based on what we learned in school. So here's the lung luo vessel, right? So the shou tai yin luo mai, right? So this is the idea of the lung luo coming from lung 7 and then branching off, down, and out through the hand. Now, if you'll notice, many of the luo channels, I say many. They're only 14 really, but there's this idea of off the primaries. Many of those lower points actually sit off of their channel. So like lung 7 sits off the channel, right? The reason why it sits off the channel, and you'll find this with like stomach 40, right? Feng Long, these different points, they sit slightly off the channel, is because, again, lower vessels are about moving things away from the primary channel, which is why they sit off the channel. So when you're treating a lower point, you're treating it slightly off the channel because it's away from the primary channel you're trying to keep things away from, right? Why? Why are you trying to keep things away from the primary channel? Because it will affect your day-to-day living, but the primary channel is also in the Ying level. So you're trying to move things away. So that's the reason why the lung luo sits here. It's off. The lung channel moves this way, and then it diverts here to move things away from the primary channel, right? It tries to keep things off as much as possible. So then we've got the heart law, right? Here's the heart law. So I've drawn this out according to what we learned. The 2 blue dots aren't anything special. For some reason, when I did a screenshot, it captured the lines that I'd been drawing with the parameter markers on it. It's done this for a couple of these, but the blue dots that you see in this aren't anything special. It just happened to catch the parameter markers. I drew this Friday night at about 1 a.m. I drew all these up to add them to the notes. So that's why you might see the blue dots on them. All right, this is the pericardium law. So here you go, the Jueyin of the pericardium law. So this moves from Neguan into the chest. Now we've got the small intestine law. So now we're moving into the arm yang, right? Something I want you to notice about the arm yang vessels. First, we'll start with talking a little bit about the arm yin vessels, and then we'll talk about the arm yang. So the arm yin vessels, right? So these show yin vessels, these arm luo mai, the yin luo mai. The idea is we start out with trying to move heat away from the chest. We try to move it out from the inside, the internal. Why? Because the internal, right? The internal is the way. It's moved through the exterior, right? It's moved into the inside. Now, this idea of it moving inside starts at the idea of even though I haven't written it here yet, you'll see it later on in the notes, is the idea of yang ming, right? So yang ming is this idea of the first internalization of external things coming in, right? Taiyang tries to keep things outside. Xiaoyang is trying to move things back outside from the inside, but yang ming is the true gate to the inside, right? It truly is the the entrance internally. And that's where you get a lot of heat, right? Things move from the chest into the abdomen. So the idea with the low vessels is that things move from the yang ming level into the yin low vessels as the body tries to shunt things away, right? So the lung law starts with trying to move heat out of that chest, trying to keep it out of the chest and the abdomen, trying to keep it out of the chest from going to the abdomen, right? That they don't want it to go to the abdomen. So it's trying to move it back out, right? Off the lung primary, because the lung primary is about the lungs and the chest to vent heat coming out this way, right? So this is the reason why the lung law sits like this. But if it's unsuccessful, then the body will try to shift that heat back. It'll move this law. You see the heart law moves back up into the chest, but it moves back up in only to move up into the head to try to clear things up and out. In the process of that, it connects to the tongue and the eyes. This is why the heart connects to the tongue, and it can affect heart law issues, can affect speech, right? And it can move to the eyes. Then if that's unsuccessful, the pericardium moves into the chest, right? At this point. Now, you'll notice that with these the hand yang vessels of the luomai, you'll notice that they have a progression of trying to move things further and further and further out again. And you'll notice a reason why you see that is if you guys ever have trouble remembering where the low points are, it's easy to remember that as you move through the sequence of the yang low vessels, that their low point moves further and further down the arm as an effort to try to move things back out again because it was unsuccessful in the first round. So that's why small intestine low point is 5 sun up, right? So it's 5 sun up, it moves up into the shoulder, right? Then when you get to the large intestine, it gets a little further down the arm because it's trying to move things back out. So that's 3 sun up, right? So it's moving things down and it's trying to move things out a little further out. It's unsuccessful. So it moves things up into the jaw and the face, right? And then you have the idea of the Sanjiao law. So if you notice the Sanjiao law, that's 2 sun, right? That's Waiguan, right? The Sanjiao 5 on the arm, right? So that's the idea of it being a little further out, trying to come from a little more distance, a little further out away from the body. So that's how I remember the positions of them. And if that's unsuccessful, it moves it down and inside the body. Again, these dots are just parameter markers there, don't relate to the drawing at all, other than the fact that they were just there when I snapped the screenshot of these. Then you have the foot yang channels, right? So the foot yang luo channels. So you have bladder. Now, the bladder luo moves from bladder, from fei yang, bladder 58, down to kidney 4, right? So it moves to the kidney's luo vessel. Then you have gallbladder, right? So gallbladder 37, Guangming moves down into the foot. So if you notice that the only 2 low vessels we've seen so far that move things outwards away from the body are the lung, right? And somebody, you can kind of say the bladder, but it's really moving into the kidney law, and then it follows the kidney law up into the body, right? So that's kind of the idea here, is that it's entering the kidney law and then following the kidney law trajectory. So it's not really moving it out away. But the gallbladder law, it moves things down and out through the foot to try to get it away, but it moves across stomach 42, the Yuan source point of the stomach. This is the first time that you may start to deposit pathology from the low vessels into the source of the body, right? The stomach law, Yang Ming. Now, I said before that Yang Ming is the real entrance internally, right, before you start to move into this internal level, right? It's the first beginning of the internalization. This is where a lot of this heat is presented, right? You see a lot of heat in the low vessels. The stomach law is the longest low vessel in the body, like the bladder Jing law, like the bladder primary channel is the longest primary channel in the body. So this channel deals with many, many things that move all the way up to the head and all the way down to the other side. It can also deal with polarization, things that started on one side as a low pathology and moved up and moved to the other side, right? So this could be an aspect of that as well. Let's see here. Q&A. All right, let's see. I have a question here. Did we get the link to the lectures notes yet? I think they're working on it. So just hold tight and they'll get it to you. So let's see. All right. So then the spleen law moves up the body from gongsun, right? Spleen 4, and it actually connects with the large intestine and the stomach. This is why a lot of times the spleen law, you can get symptoms of bloating and intestinal discomfort and pain, or abdominal discomfort and pain. So the kidneys. So the kidney law goes from kidney 4, right? And it goes up the body all the way to the sternum, just under the sternum. And then it goes inwards and comes out at the lumbar spine and ultimately to Mingmen, right? So some of you guys who will see low vessels on people in and around Mingmen do 4 in the low back, and you might see kidney law symptoms. That's a kidney law. Even though the kidney channel primarily runs in the front, the kidney law can run through the body and go to the back, right? So that's an idea to keep in mind when you're seeing this, because you may be treating a kidney law issue instead of that could be blocking or obstructing the general issue, the general running of Dumai physiologically, right? And then finally, we have the liver law, right? So here's the liver law. So this is the Zu Jueyin Luo Mai, right? So the foot Jueyin Luo vessel. And it will end and deposit itself into the genitals. So this means that it's depositing into Jing, right? Into the essence, into the Jing, that ultimately could be passed on to future progeny, or could be entering the 8 extraordinary vessels. And it may be something that you end up being reincarnated with. This is here at the gallbladder is the first signs of that, right? That the Ying level may deposit into the Yuan level, and you may end up with this being passed on to the next generation or the next lifetime. So I list the points here, all the low vessels with their, or low points with their Chinese names, their pinyin, and their points. So you know where they are, right? So here we are. So I've listed them all here in the same order I gave them there. So you've got all the lung yin, then all the lung yang, then all the foot yang, then all the foot yin. So that way you can refer to them here if you need them. They're definitely in, many of the acupuncture books out there, Andrew Ellis's book and these different things, but I just put them here just for easy reference. So if you want to reference back, if you're going through this. So time to understand pathology. Pathology of the Lomai. We have a question here. It says, I have always wondered who gave this extremely complicated knowledge to the Chinese. Well, who gave it? I think they are very smart people, and they developed it over thousands of years. I mean, who gave the modern Western biological understanding to Western people or people in the world, right? They developed it over time, right? The Chinese developed this over time. Very, very smart. There's a lot of things you can accomplish when you don't have a TV or a cell phone to distract you. All right. The idea of no technology. What is technology? Technology, the idea that electronics or electron microscopes is technology, but the understanding of principles and patterns and applied things is not technology, I think is a misnomer. I think knowledge, applied knowledge and wisdom can be technology, especially when you know how to do things, right? So like the idea, for example, in China, when you go and visit a number of their temples, they have joinery, right? So I've been to at Tiantan, the Temple of Heaven, right? They have the big Temple of Heaven kind of altar, right? It's like almost looks like a temple, but it's not. It's really an altar. That's all made with joinery, meaning no nails. It's all done with wood joinery. So the wood fits into joints, and then you're using wood to keep it in place. And it's sat like that, harmed by nature, by earthquakes, by anything else for hundreds and hundreds and hundreds of years, right? Same thing with temples in Tokyo. People are smart. That's technology, right? And the development of this technology through palpation and understanding like that, there are many ways to interact with the outside world that don't require, seeing yourself as separate from those things. And I think it's actually more about your perspective and how in the thought processes that you use than say a gadget that you apply, right? I think that's the bigger things is the method of thought that you use rather than gadgets you apply. I think that's what's really important. And that's technology, the thought process you're able to apply and use. That's really where technology lies. Um, let's see. All right. I think that there's a comment here, gadgets are for confirmation. Well, I think that's in some cases, the problem is we have gotten away from the idea of personal confirmation, right? And this has pulled us away from things like patient-centered medicine. How does a patient feel, right? We're using a gadget to test something on and on and on the outside, but we've, in many times in Western medicine, left the idea of patient-centered medicine, right? When the patient's really the center, because the gadgets become the distraction, right? And I think that personal confirmation of something is very important. One thing that was taught to me that I really take at heart is the idea that it doesn't matter what other people tell you necessarily and what other people demand you believe. True mysticism is believing what you believe because you believe it and because you have a personal experience with it, right? And you don't have to prove that to other people, but you are able to prove it to yourself, right? And you believe it for that. And I think that's confirmation. That's a lot of confirmation, right? A little personal story. So I had appendicitis due to a blunt force trauma. I developed appendicitis. I treated it with acupuncture only. I never had my appendix out. I eventually got herbs at one point, but it was pretty much acupuncture during all of the severe acute stages. When I was finally checked out by Western medicine, they were shocked because my appendix had actually burst completely. My body had walled off the infection, right? And pushed the infection to the surface and cleared it out. Why? Because I followed the methods that were understood and developed, and I understood myself, and I used personal confirmation to figure out what was going on. I treated it purely with acupuncture and a little bit of tequila, and but it worked, right? And I remember seeing some Western doctors for having them to, check it out and see what they thought, and they were floored by the fact that it had completely fixed itself. They had never seen it, but there are elements to, reality, right, that exist that many people in other places have figured out without the use of what we have today as electronic gadgets for confirmation, through personal confirmation, through other methods of confirmation, right? And I think that that's important, especially the idea of meditation, which allows you to sit and see things and open your mind much clearer to a lot of these things. I think they allow you to enter much higher realms of confirmation. Let's see. Let's see. Pain on the medial side of the heel, pressures applied, not affected by movement. How do you diagnose a channel of origin? So if pain is on the medial side of the heel and it's only when pressure is applied, chances are there's probably something, and it's not done by any sort of movement or anything like that, and you palpate around it, you don't feel any tightness in the area like that, it's probably due to some sort of qi stagnation or blood stasis in the Ying level, right? So you may be using the Luomai for something like that. You could also, if you want, if you're not finding any sort of movement causes pain at all, and you're not finding any paralysis, you may want to try needling the Jingwell point that you would see the pathology on, in that sense, the Asher point, right? Or maybe a mox of the area first to stimulate the weakness of qi. There may be weak qi, especially when you have to deep palpate, right? And then you may be even needling, say, the liver law, because the idea of no movement, right? Paralysis, it just hurts all the time, doesn't matter. That might be the idea of it. But it sounds to me like if it's deep in the medial aspect of the heel, it may be a bruise or qi stagnation down at the bone level, not in the CEU level, right? All right, let's see. All right. Let's see here, just double checking all these things that are being said. All right. Can we please talk about TMJ? We can talk about some of these things as we go on. I just want to make sure we stay on track for what we're doing right now. So, all right. So, Luomai. How does the pathology develop here? So, when an external pathology is contracted, right? External, right? It comes in through what? The cutaneous vessels, right? We talked about that yesterday. It comes in through the tendinomuscular channels, the sinew channels, right? The Jing. It will move inwards in the body if it's not being able to be expelled. I said before, ultimately, the gate of the internal aspects of the body is at Yang Ming, right? It's the internalization on the Yang level, right? The EPF, this external pathogen, will attempt to move from external Taiyang to partially internal Xiaoyang with its goal of moving internally, right? Yang Ming. As the pathogen moves into the chest, here heat is created and it obstructs the axis of qi, right? Tanzhong CV17. Particularly as the pathology is able to move more internally via Xiaoyang, right? It starts to really obstruct this, and then eventually to Yangming. In that process, it creates a lot of heat, right? So the more heat that starts to get created when somebody gets sick or a pathology comes in, the more and more and more you're moving just from Taiyang, which is generally a tightening when cold reaction, right, to a little more heat, right? Xiaoyang can have quite a bit of heat, and Yangming can have quite a bit of heat, right? Heat will be produced as the body tries to expel things harder. If you want more information in depth about this, I suggest going and buying the lecture on the Shanghanlun that I taught, and it goes into a lot of depth on that. And you guys will get much more information on that there if you're looking for more pathogenic progression understanding. So the zong qi, the qi of the chest, right? This ancestral qi they refer to as being the qi of the chest. Remember we talked yesterday about what they call the zong jin, the ancestral sinews, right? Zong means ancestor, but it also relates to this idea of this qi in the chest, right? So the zong qi of the body will try to push the pathology or the pathogen back outwards, right? It's trying to help diffuse the lung qi, right? We call that xuan fei, right? The idea of xuan fei, the diffusion of the lungs in an attempt to move this zong qi outwards, out of the chest, back to the surface of the body and the skin, right? That's the goal here. So that's the method, just explaining that a little bit. So the lung luo vessel, right? The fei luo mai, this idea, the lung luo, right? Functions to clear heat, I mentioned before, that develops in the chest by moving it outward. So when something is coming into the chest, into Yangming, Xiaoyang, and Yangming, and you're getting this heat, the luo mai will try to assist in clearing the heat away through what? Through the Ying spring points. It comes out to the lungs Ying spring. What? The lungs Ying spring clears heat in the chest, clears heat in the lung, right? Also moves to the pericardium Ying spring. Why? That clears heat in the chest, clears heat from the pericardium, right? Out across the palm, right? Diffuses through the palm. Notice that these trajectories clears through all these major Ying spring points. So keep that in mind because lung is going to be the first one to really, really, really clear heat through these Ying spring points. So a lot of times you'll see blue vessels, red vessels through the palm going to these areas, red or blue vessels showing up in different areas of the hand. I actually have one here. This is the idea here. This area here is called Daiyuji, the big fish border, right? The great fish belly. And this is an area related, they say, to the stomach. Why? Because the lung channel begins in the stomach, right? And so this reflects the origin of the lung channel at the opposite end internally. And I have a lot of blue here. And I know that I have cold in the stomach and that I've had some issues with digestion since living in China for 4 years because some of the food over there is not the best and it's affected my digestion. And so they would suggest in treating the stomach for that through diagnostics here. Sometimes some people would suggest bleeding these low points or these low vessels that you see here to treat the issues in the stomach. But that's an idea of you're seeing it. There might be bleeding that goes on the palm. It's a little painful, but it works. It can work real wonders. So this trajectory moves out through the palm, right? So also it's very important to note that the heat that develops here at CV17 Tanzhong can become blocked, right? So it can block the entire chest. So as CV17 is the mu xue, right? The mu point of the pericardium, Xinbao, right? And pericardium is the mediator between heart and lungs, right? It sits over the heart and it mediates a movement of qi to the heart and the lungs, right? So this is really important as a mediator of what? Heat out of the body. So you can see how this is a sign, the mu point, alarm point, right? Mu is like this alarm, this notification here. And so this is the area of Tanzhong where this heat is being pushed out. And so it gets vented what? To the lung luo to push it out and help vent it even through the pericardium Ying spring point, right? So the pericardium is helping to push heat out. It's assisting on the lungs in clearing heat out of the chest, right? Where? Through the lungs channel, through the lungs luo channel, right? So the Xinbao originally, the pericardium was used to treat the heart, right? Because the heart had no points, right? So there's arguments that say that the actual pericardium channel was the heart channel. Well, I would say it was the heart mediator, right? That's kind of like the idea there. So it makes sense that the lung law clears heat outwards from the chest. So it crosses the palm, as I said, through the Ying spring point of the lung and the pericardium. As the lung moves zong qi, right, in an effort to diffuse the external pathogen out to the surface of the body, the movement of qi moves out to the head and the forelimbs. So you get this diffusion up, you get this diffusion out, right? A description of the lung qi diffusing is oftentimes used as a top of a steamer. And the steamer is steaming, say buns or whatever, dumplings or whatever it is. I've seen this used in China a lot. And the steam moves and hits the lid, and the heat and the steam move out to the sides, right? This is diffusion. So this is an action of the lungs. This is how it diffuses its qi, right? If diffusion happens but is unsuccessful to resolve, meaning you diffuse out to push the pathogen out, but you're not able to fully clear it, you're not able to sweat it, you're not able to express it outwards and fully, get rid of it, then what will happen is the pathology can enter and settle into the limbs and form B, right? So if in the process of this external pathogen coming inwards, it moves its way into Yang Ming, it's moving its way into Xiaoyang, and the body gets really hot and tries to push it outwards. You're sweating, your lungs are diffusing qi even in Taiyang, but it's unable to do it. You're too weak. Your lung qi is too weak. Something like that happens. Then what will happen is that external pathogen will settle back into the joints and create B obstruction, right? Cause pain. Could even be something where sometimes you'll notice some people will hit something and they'll get physically injured and they'll develop a fever after, right? If you guys ever notice this, I've seen this quite a bit. You can see this in a lot of things that can be pretty severe. You can see this in head injuries, and you can see this in severe limb injuries and body, impacts, and then the person could develop a fever afterwards. The body's trying to push this pathology out, invigorate, motivate blood, diffuse qi, to push things out. It's creating a lot of heat as a reaction. If it's not able to resolve that initial injury that happened, then what's going to happen is it's going to settle back into the flesh. It's going to settle back into the Ying level, and it's going to create B, obstruction. So the resistance of the pathology returning to the chest, the body's trying to keep this, if it's an external pathogen like wind cold, it's trying to keep it from entering the chest, right? So the lung qi is supposed to diffuse, but then what happens? Qi is supposed to come back into the chest again, right? But the body's going to say, no, we don't want it to come back in, because if it comes back in, it brings the pathology with it, right? So it's going to keep qi going out, keep qi going up, right? But it's not going to allow it to come back down into the chest. So you're going to get counterflow, right? What we call ni qi. You're going to get this counterflow. The body wants to keep it out. It wants to push it out, right? Working to keep the pathology away from the internal environment as much as possible. Keep it out in the limbs, keep it in the head, keep it in the arms, keep it in the legs. Don't let it into the center of the body, because if you let it into the center, then it can move into what? The zangfu, right? The internal organs. And the body's goal is to keep that from happening. Also, trying to keep it away from the Jingluo as much as possible is the effort. So this is why the luo mai are activated, right? And they're kind of created or activated and used and created due to this, right? So the shui, the blood, as the blood and the Jinye are mobilized at the Ying level to assist the Zongqi, right? Because we talked about this in the ideas in the Shanghanlun, right? The idea of the body's Jin fluids of the stomach can be moved to what? Tonify Wei Qi. We talked about this yesterday, to help Wei Qi, to be created, transformed into Wei Qi, right? And they're ascended under the function of the spleen and then transformed under the function of the spleen into Wei Qi, right? So this is the idea. Again, this is talked about a lot in the Shanghanlun class. So mobilize at the Ying level to assist the Zongqi. The Wei Qi, so the Wei Qi to push the pathogen out, but wait, what did I write here? To assist the Zongqi and the Wei Qi, it's supposed to say to push the pathogen out, but the resolution is unsuccessful. The pathology and heat become held in the luo mai. So it falls back, and instead of falling back into the primaries, the body tries to push it into the luo vessels, keep it away from the primaries. It's going to fall back in, but maybe we can keep it away from the primary channels, push it into the luo mai, right? This results in the luo developing visibilities. It fills up the luo. The luo closets, it fills them up with this pathology now, right? So it fills up the law. You start to see them visibly. You start to see changes in the color of the skin. You start to see tiny little varicosities start to appear on the skin. You can start to see what they call MIB, which is vessel obstruction, right? Symptoms include things like pain in the flesh, the Ying, right? And the sinews, the Jin. You can get feelings of heat or effusion, often palpable. You can feel this heat coming off the skin, right? This is this B in the skin, right? Red patches on the skin. You can get a feeling of, it says stickiness. It's supposed to be stuckness, but autocorrect made that one. Every time I write stuckness, they're like, that's not a word, and they keep changing it on me. So that feeling of stickiness is supposed to be stuckness. The person feels stuck. They feel like, oh, I can't move. They feel oppression and pressure, right? And that's the idea there. So it's stuckness. Stuckness is what? Ni chi. It's counterflow chi. It's pushing out, and things can't come back in, and you can't push out anymore because it can't be resolved. So what? You feel stuck, right? You're stuck between a rock and a hard place. You're stuck between the counterflow chi outwards and the inability to release the surface, right? So you're stuck in the middle. So then what happens is, okay, let's push it into the lomai. Let's keep it out of the center, right? So the little varicosities are not just a long time insufficiency of vitamin C. No, they're a little bit more than that in Chinese medicine. They have a very deep physiological and pathophysiological connection. And so understanding them at that level is really important. So what we'll probably just touch on today is how to use the lomai vessels to treat injury, but like as far as physical injury, swelling, musculoskeletal injury and some of the B, but there's a lot more to internal problems that can go on. Treating people's obviously emotions, but also external pathological factor that's been internalized, right? It's moved into Yang Ming, and then it's been tried to push out, unable to resolve. And so it sits now in the Ying level. And then what happens is as it falls back in, as we'll explain, it falls into the lomai. I think it says here. And then the lomai, pushes up into the Wei level, right? So this is what it says on this slide. So because the lomai, they fall into the lomai then try to push them up to the surface, right? Because you release things through where? The Wei level, right? So the lomai push up to the Wei level, right? This is why you feel lomai B as being sometimes obstruction in the sinews, because you can feel trouble moving, you can feel stuckness, you can feel these things because the varicosities are now, you can see them. They're up in the Wei level. They've pushed up into this area of the sinews, but they're contained, right? So the pathology is still within the lomai. It's still in a Ying level structure, but a structure that's pushed up into the Wei level, right? It's contained. It's a hydraulic pressure, right? So the pressure, this fluid pressure from the laws pushes up, right? Pushes the Wei Qi kind of downwards as it pushes up, right? So it does this. Now, I imagine this a lot of times you can think of like, you remember those old games of like different color oil or fluid, and you could turn it sideways and you get the things that would like move. You get the color move one way of one of the fluids and another color move the other way. That's kind of how I envision the lomai and the Ying, the lomai and the Ying level and the Wei level, like the CEUs and stuff. Things kind of push like this, right? The lomai kind of push up a little bit. They're trying to express upwards. However, they're unsuccessful at full expression because why? They can't push through the skin, right? How about nodules in between the skin and the flesh? That's an empty law. That's an empty law. We'll talk about that. Okay, let's see. So we can develop things in the sinew channels that you can feel from lomai obstruction, like what they call Jin B. Yesterday, we talked about Jin B obstruction in the sinews a bit. And you can treat it with the sinew vessels, right? Or the sinew channels, right? So B obstruction in the sinews can occur also because the law vessels can express into the Wei level, and it's a lomai issue. You can see the varicosities, right? Law is about this visualization, right? But because it's pushing this visualization up into the Wei level, into the area of the sinews, you can feel it in the sinews, right? So this does not necessarily affect the joints, though, but rather the sinew channels and the musculature of the limbs. The body is trying to move pathology away from the chest. So generally B obstruction will happen in the sinews of the limbs rather than of the chest, right? So you're going to feel this B obstruction in the limbs, right? You'll feel it in the musculature, on the surface, but not inside the joint. The low vessels float classics say that they float, they don't enter the joint. So you're not going to feel them in the joints. In the joints, in the big joints and stuff, that's going to be the Jingbia, right? The divergent channels. So B, right? So this idea here, B due to the body creating rebellious chi to move pathology to the limbs does not create arthritis. So if you're looking at an arthritis patient, the lomi aren't what you're going to use to treat that arthritis directly. You might look to clear out channels and stuff around the area overall to clear the area from obstruction with the law, but you're not, especially in the Ying and the Wei level, but you're not going to be arthritis in the joint. What do we talk about? Arthritis in the joints are related to the divergence, right? The divergent channels. That's going to be something that's deeper. So if you're working on arthritis, if you're working on changes in the joints, changes in the bone, you're working at the Yuan level. That's where that is. So you're going to have to treat the Yuan level, right? Now, people can argue and say, well, I can use the sinew channels because if I adjust the alignment if I loosen up the sinews and it can adjust the alignment of the bone, then it can treat the arthritis because the bone will now be aligned. That's great if you can do that. And I've done things like that similarly, but again, that's not treating the bone itself. That's treating the sinews to relax and release them to allow for structural alignment, right? That's the idea of treating function over form. You guys understand that? All right, cool. All right, so we have this idea of GB or Rou B, right? So GB is this idea of this obstruction of the flesh, right? Jiro is the name of like muscles or flesh in Chinese. So GB is like, obstruction of the muscles or flesh, right? So it's characterized by pain in the flesh, sweating, limp or emaciated limbs, numb flesh, and a clouded mind. Why? Why is it a clouded mind? Because what controls the flesh? Spleen, right? So you can see spleen issues if there's obstruction because the spleen has already been affected to create this obstruction of the flesh, right? And we'll go into this a little bit. So the other one we have here is Jin B, obstruction of the sinews, right? So you can see this in hypertonicity of the sinews, pain around, but not in the joints that affect movement. What I mean by that is, for example, if you guys do martial arts, so I practice martial arts. So say if you're grappling, right? So say somebody does grappling, if they do jujitsu, for example, right? And they do a lot of gi grappling. A lot of my patients will do gi grappling and stuff, or shuai jiao, right? Chinese, that's another one too. Chinese fast throwing, like kuai jiao, that stuff with the jackets, right? Do a lot of jacket grabbing to throw, judo, right? They grab and they're doing a lot of throws. A lot of times they'll kind of, in the effort to grab and hold something, they'll go and they'll throw somebody, right? And they'll feel like the muscle, the fingers tighten up, right? And then they might feel pain in the finger. You'll see a lot of these guys who do judo, who do shuai jiao, who do jujitsu, they tape their fingers, right? Now, in this case, a lot of this is actually B obstruction of the sinews. It's not actually in the joint because when you ask them and they move their joints, they'll say it feels tight when I do this. And they'll talk about how the pain is here and it's around. It's not really inside, right? That local area where it's tight and it affects the movement, but it's not inside, that's called Jinbi, right? That's called obstruction of the sinews. That's not a joint issue. That's a sinew issue, right? To give you the idea of how you can get hypertonicity, it will tighten up because they've wrenched it. But the pain isn't actually in the joint. It's around the joint, right? The area of the sinews on the surface that connect, but not inside the joint. That's Jinbi. That's the obstruction of the sinews, right? You could use a sinew treatment for that. You could also, if you see lomi or you think the lomi are affected, you can use the low treatments for that. All right. So, and the other thing that you can see as far as obstruction is, like I said before, might be, right? Obstruction of the vessels, which we said has things like symptoms include feeling of heat and effusion, often palpable red patches. Why? Because the blood and the lower vessels help to color the skin, right? So you're going to see redder patches and feeling of stuckness, right? You can also have pain upon pressing in the flesh and the sinews. Why? Because the flesh is the Ying, right? And the sinews is the idea of the Jin, the Wei level, right? Okay. Oh, question here. How about fatty deposits under the skin? That could also, if you're talking about nodules, right, what they call tanhe, right, this idea of these phlegm nodules that feel like small little fatty deposits, that could be an empty luo in that case. A lot of times that's seen as such, something that gets deposited afterwards when it dumps back into the primary. But we'll discuss a little bit about that. All right. So I don't know what the term Dupuytren's contracture means. I would have to know specifically what that condition means to tell you if it can be used for the sinews. Generally, the idea is that you're going to try to use each channel system for everything to determine much clearer what it's better at doing and what it's not so good at doing, right? But there are some people out there, and there's a suggestion too that you try to, Jeffrey would encourage us to treat for everybody, every patient you have for a month or 2 months or 3 months in a clinic with a single channel system, maybe even years, right? Only use one. Classically, maybe you'd only learn one channel system, maybe the sinews, and you do that for 2, 3, 4 years before you moved on to the next one. So you could clearly understand the parameters of it, how it works, how to get it to work in certain situations, right? And then you might move on to using the lomai and learning how you use the lomai for every patient you have for the next 2 or 3 or 4 years, right? And you're learning all the parameters of that. And, this was how it was done. And if you take that on, you will really start to see the depth of how these things work. And it will help you to understand other methods of acupuncture because you'll understand where they fall within the idea of the levels of the channels, right? This is how acupuncture is designed. Doesn't matter if it's even balanced method, right? Dong style, tongue style, all this different stuff. This is why yesterday when I said the idea of dry needling, right, or this ligament needling and all this is all sinews, as you can see now. It's all sinew channels, just without the understanding of it being sinew channels. They've pulled it from sinew channel needling, right? And they've just rehashed sinew channel needling and rebranded it something else, but they really just, ripped it off and did that, or they claim they invented something new that's not really new because they don't understand the underlying physiology and pathology, right? So this is where you can use this. Ni chi is the idea of counterflow chi. Okay, Palmar fibromatosis. They treat it with surgery. It would be amazing to treat with. I would have to look. I will look more into that on break, and I'll get back to you with some explanations on that. I'm sure I know acupuncture can treat it. There's not an issue. It's just about the direction you might go, how long it might take, things like that. With cysts on the finger near the joints, but not in the joints, that could be associated with, if it's a cyst, if it's body fluid, then that would be the Ying level, right? Then that would be the idea of the lomai, right? So from the chest, so we have here now, from Tanzhong, right, from the chest, the qi, the shui, and the jinie are moved out to the limbs to assist the body to push pathology away, right? From the chest. They want to keep this pathology from going internal. The circulation of these three, right, the qi, the shui, and the jinie, back into the chest is impaired due to the idea of counterflow, right? Counterflow from pushing it out. The counterflow is trying to keep it from coming back in, so it keeps pushing it into the exterior. I'm repeating myself here just to keep this in because, repeat it a few times to yourself and it'll start to sink in. Over time, the heat from this action results in the consumption of qi and yin, right? So once finally consumed, once the qi is consumed, once the yin is consumed, the body is no longer able to produce heat, right? And it can no longer be able to push out the pathogen. So therefore, the body becomes cold. So the idea of keeping this pathology out is the idea of keeping it hot. It's going to be out. It's going to stay away. I've got this qi to push it out, and I'm using yin fluids. I'm using blood. I'm using jinie to push it into the low vessels. Why? Because the substance of the yin are the fluids in the blood, right? This is all this yin qi is fluids and blood pushing it out, right? Keeping it out. And when that burns out, then the body becomes cold and you can have the pathology eventually dump back into the jingluo and come internally again. It depends per person. So Tina asked, over how long of a time could this happen? It depends on the person, how frail they are, what their constitution is, how much, how much fluid and chi they have, how much blood they have. These things are really, really important to understand.
So I have another question.
Mhm.
So here you're talking about, the body creates the heat to try to push the evil out. So it reminds me of how we're treating COVID patients now, right? With acupuncture, with herbs. In the beginning, you never want to just use heat clearing herbs.
Yes.
Is it the same with acupuncture too? And if the patient has high fever, do you let them run with the fever a little bit longer before you treat them so that it can push the evil out?
I will oftentimes support the idea of, if I'm treating, for example, COVID, because you wouldn't use the luo mai immediately, right? You probably use the idea of, usually when COVID comes in, at the immediacy. If you're talking about something in the way level, I might support, if you want to use if we're using the channel theories as we've been talking about starting yesterday, the idea of the immediate feeling achy, feeling cold. What do you want to do? You want to tonify yang, right? To push it out. So if you want to use the channel theory from yesterday, the idea of using the sinews, you would do a tai yang sinew treatment.
So to recap what you just said. So initially, when they first catch COVID with the chills and the body ache.
If they're in a wind cold condition, right?
Okay.
So wind cold is what? Tai yang. So if we want to use the sinew channels to treat an external pathogenic factor, you have it can apply to this a little bit because the person has musculoskeletal pain, right? So it kind of stays on the same subject that we're talking about. So the idea is that they're having a tai yang expression, right? So you would do a tai yang sinew channel treatment. So you could do the releases of do 4. What will that do? That will stimulate yang, right? Coming up the body, coming up the spine, just like we talked about, just as talked about in the Shanghanlun and the Neijing, right? You're still doing the same thing. You're stimulating that yang to come up the spine, to go into tai yang, to come up, to get this external, expression. And then you find the usher points and you needle them. You may moxa in some cases. If you have, tightness and cold, constriction in the area, you might moxa those usher points. Those are obstructions of yang qi being able to move, right? And then you will go and hot needle the bladder jingwell. And that would be a tai yang sinew treatment to treat things that are in the way level. Doesn't matter if it's COVID, doesn't matter if it's a common cold, doesn't matter if it's Ebola, doesn't matter. That's what you treat because it's that expression in that level.
So would you use the luo mai then when that actually turns into into lung heat?
In lung heat like that, this idea, you can use lung 7. The idea would be using lung 7 to clear that heat in the chest. You could use that. However, I found that a lot of times the body isn't able to push things that quickly into the luo mai. It stays in the primaries and the body ends up oftentimes pushing it into the divergence. That's just what I found clinically. But what you might find with this is long COVID. People who they pushed it out. They kind of partially resolved, but then it kind of got pushed into the luos and stored there. Now you notice they have pain. They have pain around the joints. They have things like rashes. They start developing these very strange symptoms, but you notice these varicosities. You're seeing, they may have issues, heart palpitations. They may have low back pain. They may have sore throats. You're noticing these symptoms based on the trajectories of the lower channels and based on what's going on. Then yes, now you're seeing what we would call today long COVID or a long, slow expression of a disease. It's kind of pushed into, some sort of lowered pathogenic state or latency. And you're getting this kind of upflare from time to time in that sense. And you're seeing it in the low vessels, then I would look there. So you're going to want to see visualization with the luos. You're going to want to see varicosities, right? If it's full or if it's empty, if it's emptied back into the primaries, you're going to want to palpate for nodules and look along the primary vessel for varicosities. We'll talk about this in a bit, but when the lower vessels are full, the low vessel I described, going back here, for example, let's go back so I can show you. So the low vessel I described for gallbladder, let's say, if you have a full luo for the gallbladder, you will only see the varicosities you're paying attention to are the varicosities here. This would bring a full luo. If you're seeing varicosities here with full luo symptoms, you're seeing a full luo gallbladder presentation. But if these luo vessels have all disappeared and it's emptied into the actual primary channel, you might be seeing luo mai here, right? That's emptied out of the luo vessel and gone into the primary. So that's an empty law in that case. So this comes into a clinical aspect of how to treat the law. So you'd want to look and see palpably where you might see nodules if it empties. You might not always see varicosities when it empties. You can see more like what they call tanha, right? These phlegm nodules and things like that under the skin. But you would be, in that case, bleeding those and then moxa, or you might be lifting and thrusting on those, right? To help clear these things out. Along with, you still have to bleed the lower point. We'll talk about that in a bit. It's too small to see where I'm pointing to. So look on your charts. If you look on the screen that we're looking at right now, this is the gallbladder lower vessel. This is what I was pointing to here. The gallbladder lower vessel only goes this distance before dumping into but if it's full, before dumping into what? The gallbladder primary. It empties into the gallbladder primary. This is a full low gallbladder vessel. And then if it empties, any visualization here goes away pretty much. And then you can see it up the body instead. Can we, let's see. I got a lot of questions here. How do you treat memory loss and abnormal, not lack of, but abnormal taste and smell that can appear to be changes in the brain? Can we use the low vessel approach? You can. That would be a whole thing. But again, that's not the point of this class. It sounds like to me they have some spleen issues that you would need to work on there. Can we release DO14 as we did for Sinews to expel an acute wind cold external pathogen? Yes, you can do that. That would be the idea if it's in the Sinews, right? The idea of using the Sinews to expel external pathogen. If it's Taiyang, you're using Taiyang. If it's Xiaoyang, you're using Xiaoyang. If it's Yangming, you're using Yangming. That can be done. I've done that before. It works very, very well. In fact, you'll find that some people think it works the best. Why? Because it's keeping things in the external layer, right? You're not using the Jing law, right? Because you don't want to accidentally push things into the Yuan layer. So all right. So some people are asking about the gallbladder. If you look at the screen right now, you see where the mouse is. This is what I was showing. This is the gallbladder low vessel. So when you see a fullness of the gallbladder low, you're going to see it here. You see on the screen where I'm moving the mouse? Sorry. It's already drawn. I figured that we just. Oh, yeah. Annotate. Draw. I can draw. I use a circle.
Yeah, you could go circle. Yeah.
All right. So an example here would be like this. So here is what we're talking about here. You see that? That here, bunk. This here is where the gallbladder law exists, right? So this is where the full gallbladder law is. So you will see an expression of varicosities coming to the surface in this area if the person has a full gallbladder law with these symptoms. As it empties, you'll notice the law in this area will disappear and they'll reemerge on the primary channel, right? And they'll reemerge with different symptoms. The symptomology changes because you're no longer able to hold that pathology away from the primaries on the low vessel. You're now dumping it back. So you're going to find more primary channel symptomology. So you either have a full law or an empty law, right? Goes back and forth. And there's a difference in treating it. A full law is the idea that the body has enough yang, has enough resources to keep it up on the surface, keep it away from the primary channel. But when the body does not have that anymore, or the law is too full, it dumps back into the primary, which means you actually have to support the body and bring it back out. So you have to tonify, give the body yang qi to help it rise back to the surface. And we'll explain how to do that. I'll just tell you right now, but we'll go over it later. The idea of, whereas normally with a full law, you bleed the low vessels you see, and then you bleed the little varicosities, and then you bleed the actual low point. When you have an empty law, you bleed the varicosities you see, and then you bleed and moxa the lower point. Why do you moxa? Because it gives the lower point itself yang to pull this pathology up, to bring it to the surface, to express it out, right? All right, let's see. All right, let's go on. Oh, how do I get this annotation to leave? No, I don't want it anymore. Close it out. Right here. This one?
Oh yeah.
No.
You want you don't want.
I'll just erase it, maybe.
You don't want more.
Okay, like that. Cool.
You just have to clear all the.
Gotcha.
You go hide. I'll leave it on for you.
All right, cool. All right. Let's see. We got a question here. What about an EPF such as genital herpes that do not first pass through the lungs, but symptomology are not heat in the chest? So that came in right at the area of the liver, right at the area of the genitals. So it enters into the liver law, right? You don't have to have everything pass through the lungs, but this is the idea of an external pathogen at the most exterior coming in. So you're seeing it in pieces, right? So that's something that can enter right into the liver law itself, right? The liver law goes to the genitals, is expressing on the genitals. It came through. The herpes came through sexual intercourse, most likely. So in that case, it would be something in the liver law itself. So you would bleed liver 5. In fact, the classical explanation or symptomology for that is what they call cruel and unbearable itch of the genitals, and that has a lot of meanings. It's physical. It means like there's can be itching and pain and burning in the area, discomfort, but it can also mean a couple other things. It's very clever, right? It can mean somebody who has sexual addiction, right? They have an itch they can't seem to scratch. It's, they keep having to go, and you can have these issues with sexual addiction. Or it can be somebody who's so prude and unable to express themselves sexually that they have this retreat into themselves and they're not able to express themselves. Those things are both considered liver law issues. Again, this is why I suggest you go and study the law vessels with Jeffrey. He's incredible, absolutely incredible at it. So definitely go and study with him. All right, so let's get through here. We talked about all this. We talked about this. All right, so it can fall back inwards, we mentioned. Shut this here. All right. So effects of counterflow qi, right? Ni qi. So what can happen when you see counterflow qi in somebody? This is where you're going to see pain. You're going to see things that are issues with an imbalance of yin and wei, right? So B can result from an imbalance between yin and wei. As Ni qi travels up to the head, it can affect things like the sensory portals. So you can have this after COVID. So somebody here mentioned this before about issues with the head, abnormal lack of taste, things like that. If you're finding that you're seeing varicosities in the head, in and around the nose, areas here, it can follow the pathology of the pathological. If you're having a pathology in that area, it can follow the trajectory of the stomach lual vessel, right? So as Ni qi in the stomach affects the flow of its yin pair, the spleen, you can start to see issues in the limbs, right? So first it starts with the sensory portals being affected. Why? Because the jin fluids that would go to two places, go where? It would go to the eyes, right? It would go to the eyes and the nose and the mouth. It would also go out to the sinews, right? The pure aspect goes up here. The turbid aspect goes out to the sinews. As that becomes affected, you're going to start to have issues with the limbs. And the stomach itself, with the inability to make the jin, is also a sign that what? It's going to affect its yin pair, the spleen. So what do we know in Chinese medicine? What do we know in TCM? That the spleen controls the 4 limbs, right? So as the spleen's function declines and is affected, you're going to start to have limb problems. This is where this B obstruction comes from, right? So you can start to see internally how it's happening, internally with the ability of the Ying level, right? The Zangfu at the Ying level, and the Jing law, the primary channels which are involved in general function, physiological function of the body. As they start to become affected, you start to have this B obstruction occur in the limbs. All right, so As the way affects the spleen loses control of the limbs, right? So as the spleen loses control of the limbs, this is when you get bi of the limbs. We say in Chinese, we call this bi wei bu he, which means that the spleen and stomach have disharmony, right? So you heard of that spleen stomach disharmony or stomach spleen disharmony, right? This creates what we call shi qi, dampness, right? You can no longer digest, you can no longer transform, right? So this creation of shi qi is a sign of the progression towards bi. So as this external pathogenic factor comes in, like I said, it affects the ability to create the pure fluids, the jinya, the pure fluids and the turbid fluids, and the pure fluids are not able to ascend to the face. Instead, you start to get dampness. You start to get issues of congestion and mucus in the eyes and the nose and things like that. You start to get more dampness forming. You will know that you will start to see bi obstruction of the limbs, right? And this fluid is coming from what? The Ying level, right? It's coming from the level of the Luomai, coming from the level of the Jing Luo, right? This is all in the Ying level. The creation of dampness is a sign of a progression towards bi. This becomes an important aspect, again, in the Wai Ke external medicine. Again, more on Wai Ke. Also, I have for you guys here, let me see if I can find it. I pulled up that book. Some of you guys were asking. I found a link on Amazon for it, but you guys, I'm sure, can find it in other places. Let me put this in the chat. It's a really good book on external formulas. It's worth it. It says $150. If you can find it on PDF, that's great. But that's it right there. So I just put it in the chat for everybody to see. So that's an example of a book on a lot of Wai Ke formulas for all sorts of things. So if you can find it on other things, Scribed or these other places online, I would definitely suggest getting it, going through it. It's invaluable. It's a really, really good book on these different formulas for herbal medicine approach. There's a series of books that came out of China on a series of different things, including acupuncture and stuff for various problems. They split them up into more kind of a mixture of Western and Chinese specialties. I'll see if I can find a link to those too. Some of them have Wai Ke books and things in them as well. Let's see. So we have this. So the dampness is formed. It's a sign of progression towards bi, right? This is an important expression of Wai Ke, as I said. So why does Wai Ke focus on the creation of shi qi? Why? Because we said the fluids, the Jin fluids, are under healthy conditions, go to nourish the limbs, right? Under right, we move this idea of the turbid aspect to the limbs, right? To the sinews, particularly in the limbs, via the liver, right? We also move it to the skin, right? The turbid aspect to the skin under the lungs. We mentioned this yesterday. And then the head, what we call the shang chao, the head, the upper orifices with a pure aspect, right? So we move that upwards. So it moves, when we move this upwards, we move where? Along the stomach channel. So the major trajectory of the stomach channel actually only lies on the face. Stomach 1, 2, 3, 4, it comes around to here, right? And then the branch comes off and comes down. All of this extra stomach channel that we treat so majorly is actually a branch. The major trunk of it sits on the face, and the whole physiological aspect is to move those fluids to the orifices, right? That's the goal. That's the goal in that sense. So the idea here is this is why we need to focus on, if you're seeing dampness and it's occluding the orifices, if it's occluding the upper body, if we're seeing the spleen and stomach starting to create dampness and affecting the body, then it's going to affect the limbs. If you're seeing that along with bi in the limbs, you're going to have to treat that dampness first. That's going to be a major thing. You're going to have to treat and open the portals. That's really important, right? So the patient is most likely to exhibit some level of obstruction in the orifices along with the bi, the limbic bi. So if under pathological conditions, the Jin is becoming dampness, then you will have to address the obstruction of orifices while also treating the sinews, as I said. So as the Luomai become full, holding the pathology in the limbs, acute bi can form, right? So the Luomai is filled up, you start to get obstruction in the orifices, you start to get this bi forming in the limbs, right? It can be in the sinews, it can be in the flesh, it can be in the vessels. So the longer that the Jing Luo hold on to the pathogen without being resolved, the more common, doesn't matter what this is, doesn't matter if it's Luomai, Doesn't matter if it's Jing Luo, it doesn't matter even if it's a sinews, the more chronic the bee will become, right? So that's something, doesn't matter, whatever channel system it is, the more chronic it becomes, the longer you hold on to it, right? So the following strategies then can be used to help to design a treatment for both conditions. So I want to kind of give you guys something, give you kind of a little clue as to what I'm doing, because I teach in very much the same way I was taught. I didn't learn things based on, use these points for this and use those points for that. We were taught how to be Chinese medical thinkers in school, right? Think about things through Chinese medicine and learn to apply them. So we were given strategies, how to approach things and understanding, but understanding that you may change it for certain things. So what I'm doing is trying to deliver you strategies. We've already gone over the idea of the Wei level, right? And we're going over the idea here of things that go on in the Ying level, right? And so you may find that, for example, an injury happens to the Wei level and the Ying level. So you may be treating with both, say, Wei level channels, which would be the sinews, and Ying level channels might be the lumai, right? You may be doing, as we said yesterday, you may be using some of the Ying level to support the Wei level if the Wei is deficient. So you may be using the Shu stream points, right? If the Wei Qi is deficient, or the mother point elementally of that Jing Luo that's associated with the Sinew channel, right? So things like this are really important too. So, if you have Qi deficiency on the large intestine channel, right? You might be using the point of, it's metal, you might be using the earth point on the large intestine channel to support the Wei Qi. You're using strategy to understand how to do this, right? It's not just, use this point because it treats headache, use this point because it might not work, right? Large intestine 4 is used by a lot of people to treat headache, but why? Why does it use to treat, right? The idea of, let me just put it there because it's a point for the head. If you're not understanding why, you're not able to break down the reason why the person has the issue, then your acupuncture is only going to be mamahu, right? It's only going to be so-so. You really need to understand why and how this stuff is applied to have a good effect. I mean, that's the reason why acupuncture is a deep study. Chinese medicine itself, my belief, is even a deeper study than Western medicine, right? It requires a lot more understanding of the whole picture, right? And understanding that. And that's just something I've experienced from having gotten degrees in biology and then a degree in Chinese medicine and really seeing that, how do you treat rosacea? Well, again, there could be many ways to treat rosacea. If you're thinking about it from the low vessels, and you're going to need to look to see what low vessels come to the face, the stomach comes to the face. You're going to need to see what underlying conditions they have. But this isn't a class in dermatology. We're focusing on the musculoskeletal conditions here. All right. So think about this. As the lomi become full of pathology, heat consumes the yang qi, right? And cold can begin to constrict the area. That's why you can feel tightness, right? As the yang qi is not able to warm and keep the sinews relaxed, you can feel cold, right? Where the pathology is being held. You can see both heat and constriction signs if the lomi are involved. You get the heat signs because it's holding on to this pathology, right? You get this yang qi that's holding on and this back and forth with the pathology in the low vessels. Remember, especially if it was pushed there from finally entering the yang ming or the xiao yang, you've got a lot of heat. Then that heat is going to be stored off in the lomi, right? You're not really using the lomi to treat an exterior wind cold condition because that would be in the Wei level, right? You're using it when it gets interior. What do we know about interior? If anybody knows the Liu He, the 6 levels of Shanghamun, you have the idea of what? It moving into the Yang Ming and Xiaoyang and Yang Ming, and you start seeing a lot of heat, right? So we've got this heat. So you can get constriction and tightness and heat, right? So you can see both of these things. So look for the following signs and symptoms along with visible lomi, with visibility of lomi, and compare them to other diagnostic tools, right? Including tongue and pulse and these things, right? You're going to do all of this. So these are symptoms you want to look for. They are trajectory symptoms as described in the classics for the Luo conditions. So the lung Luo vessel, right? The Fei Luo Mai. Pain in the throat and chest, right? This can be something that you see, right? Why? The goal of this is to move heat out. And if it's unsuccessful, well, if it's moving heat out, where does that heat reside? It resides in the chest and the throat. So if it's obviously unsuccessful to do it on its own, it's going to be sitting here still trying to move heat out, right? So any sort of pain in the throat and the chest could be associated with B obstruction in the lung lower chest vessel, right? So B obstruction that's sitting in the pericardium law would be associated with neck and rigidity, right? So neck rigidity, not being able to turn, not being able to look, right? Another association with this sometimes could be things like meningitis, right? A swelling of the meninges and inflammation of the meninges in the brain that can be very painful and you can't move your head, right? Is oftentimes associated with the pericardium lower vessel, NAQ1, right? So neck rigidity. Neck rigidity is something you can see in patients who have had, for example, long time issues with the back. A lot of times patients who have had back surgery after back surgery starts to affect what you can see a discoloration along the back, along the neck, a lot of heat, right? Coming up, a lot of flushing here. They can't turn their neck. They can't turn their head. This can be a pericardium law issue, right? So also things like the heart law, right? So the heart law would be chest pain, right? You have chest pain. It's trying to move it out, but it's unable to. It's unable to. So you can see chest pain with the heart law, with B obstruction of the heart law. Other law my B obstruction includes small intestine, right? So the Xiaochang law my is the idea here of upper limb pain. So pain in the upper limbs. If you looked back at what we talked about how the small intestine law runs up the arm and spreads out through the shoulder. So you get this upper limb pain, shoulder and upper limb, right? So if you're finding B obstruction in the upper limb and you're finding these laws, these small loci, or this discoloration of the skin or flushing, you're probably dealing with what? B obstruction in the small intestine law, right? So the Dachang loci, this idea of the large intestine. Now, this is an interesting one because I've treated this quite a bit, actually. Large intestine, you'll see this done in the transverse law treatments that are done a lot. The idea of treating things like toothache, mouth, and gum pain. So large intestine law, starting here, moves up the arm to large intestine 15. All the law of the arm move through this area, right? And it moves up to the face and it spreads out to the teeth and it spreads out to the ear, right? So you can get this idea of mouth pain. It spreads across the top here. And so you get this idea of mouth and toothache, particularly along the top of the teeth. And you can get gum pain, right? And even receding gums, heat, right? Heat and yang ming, this idea. So people who have stomach heat, it can recede, right? So then the Sanjiao Luo Mai is the idea of elbow pain. So that can be seen in this case. You can get in the small intestine, you can get the idea of looseness, feeling loose in the elbows. So this is upper limb pain, but it can be also this idea of feeling like the joint is loose. Like it can't really hold. You have upper limb pain, it can't really hold. But by the time you get to the Sanjiao Luo, you can get the idea of stiffening because the body was not able to move blood into the area, right? Because the blood is starting to become deficient. So now you get stiffening. The sinews themselves are not being nourished by the blood and the sinews stiffen, right? Kind of like they dry out, they stiffen. And so that elbow pain can come with stiff elbows in the Sanjiao Luo versus small intestine upper limb pain is more looseness of the joints, right? That can be that. Question here. What about a history of whiplash regarding pericardium? Yes, you could find that, particularly if it wasn't able to be resolved. You can find it. If you start to see issues with the coloration around the neck, then you can see whiplash that was like old whiplash that was not resolved. I would start off with if it was an immediate thing, obviously I wouldn't jump to the laws immediately unless I saw bruising or fluid, stasis in the area. I would start with the sinews. But if it's been sitting around, the body hasn't been able to resolve it in the exterior, then what happens? After years, it can fall inwards, right? Because the body can no longer resolve it. It's been inflamed. Their neck is hot. Then the body starts to weaken its ability to hold it out. So it starts to move in, right? And it moves into the Ying level and it ends up in the lower vessels, right? Does that make sense? Okay. So we're going to break here. And when we come back, we will start on the leg yang channels. All right. So I'll just put this up. So we're going to break for 10 minutes.